My name's Jake Camp. I'm a clinical psychologist and DBT therapist. DBT stands for Dialectical Behaviour Therapy. What's really great about DBT is that it's not a sort of strictly manualised treatment like some other treatments. We like to refer to it as principle-based, and this means that your therapist has like this whole toolkit of stuff available to them that they can pull on when, particular targets or difficulties are coming up for you. They can use that toolkit flexibly, based on their judgment, but also based on the evidence base of what works in order to try and target those difficulties as well. Some of these principles that we might refer to are, we have lots of techniques that are on our sort of like change side of our sort of dialectic or of our sort of skill set, which is very similar to what you'd see in typical CBT. So that's a lot of problem solving. We're very, we emphasise a lot on problem solving actually being a really hard skill and stuff that's not usually taught, in our sort of natural systems. There's maybe like learning how to change or modify thinking. There's doing things like exposing ourselves to like, scary stuff or things that, particularly causes or prompts certain emotions. We teach skills to help obviously you navigate, life in a different way. And that's that's one of the most well-known parts of DBT is our skill set that we have. On the more acceptance side of our dialectic is very much bringing in those acceptance principles of learning skills around reality acceptance, mindfulness skills, which have been drawn very directly from Zen. And the original creator, Marshall Linehan's, real deep dive into Zen practice and meditation, and translating that into a useful way to use in a behavioural therapy. Validation, which we also think is really important because we think that often a lot of what contributes to difficulties developing is the interaction or transaction with invalidation in the environment. So we really want to build up those skills as well for the therapist, for you as the client, but also for your environment and the people around you. Some of the other principles that we draw on are behaviorism. So we're usually, really interested in what cues or causes behaviours to happen. What are the consequences that maybe make the behaviour more or less likely over time, and how we utilise that information to change things that you want to change or that we think are important to change. We also use dialectics. So I've already alluded to that. It's in the name, right? It's a big part of DBT. And it's one of our main philosophies that underpin our style and how we think and how we structure, our thinking. Dialectics is a big topic. I suppose the sort of shortest hand summary is to say it's the idea that, of course, multiple complex and potentially opposing truths can all coexist at once. I can both like something and dislike it at the same time. I can like it and dislike it, and you can sort of hate it, all at the same time, and those things will all exist, and that's okay, sort of thing. The idea is to work within that to find, our way forward or a synthesis, using all of that information. And the main dialectic that we really pull on in DBT is, I've already referred to as acceptance and change. So the idea here is that, both of those two things, coexist and are often necessary together. And we actually think that, you kind of need acceptance in order for change to happen. And in order to accept, you need to first change, any non-acceptance that's happening. So it's a pretty complex process. But it's one of our sort of main philosophies, and is a really great way to build sort of flexibility of thinking and viewing the world. The sort of top tip and the sort of quickest way you can start to become dialectical is by replacing all of your buts with ands. And that's because when you say but, the second part of the sentence negates the first part. So I like this piece of food, but, or it's a bit soft and maybe, gone off a little bit, and that conveys the meaning of, I probably don't really like it ultimately, therefore, right? Whereas, to say and conveys that both are true. So I really like this food and the lettuce was a bit soft, sort of thing, which conveys both. The last principle, which is important, don't forget this, Jake, is the biosocial model. The biosocial model is our underpinning understanding of how difficulties develop. It's a pretty complex model, and if you come to DBT, we use it a lot, we think about it a lot. But I suppose just to briefly summarise that the idea here is that Emotion dysregulation being our sort of core area of difficulty that we think leads to lots of other areas of difficulty, because if our emotions are a bit like a roller coaster, things like our relationship, our identity, the way we behave, the way we think, all of that is going to sort of have a similar sort of roller coaster type feel to it possibly. So it's all interrelated, but we think emotion dysregulation is the core bit, and this is what we target, sort of most heavily. We think the reason that that develops for some is because some people maybe have a very early, maybe biological or temperament-based sensitivity to emotions. That means, they feel their emotions maybe a little bit stronger, and they take a lot longer to come down to baseline than the average person. But over time, that would make any person who maybe is a bit more sensitive to emotions very vulnerable to invalidation in the environment, because the environment isn't well fitted often with people who have emotion sensitivity. So that might mean that the environment, and by environment I mean that could be parents, people in school, that could be anyone around you, may subtly or explicitly communicate to you that your emotions are not valid, or your internal world just for some reason doesn't make sense, maybe is like too big, maybe too little, that actually it's really easy to problem solve. Like, why don't you just go and make up with those people that you've fallen out with? Like, that'll be fine and easy, right? And that those subtle sort of and explicit communications over time interact with that emotion vulnerability to mean that, maybe you learn to mistrust your emotions, you learn to, try and push them down a bit, or, maybe you even learn to use bigger behaviours to get needs met because needs won't otherwise be met. And ultimately that then leaves you a bit de-skilled in how to manage your emotional experiences going over time. So hence leads to emotion dysregulation. We also think that minoritized groups or people who show any early differences, so it can be based on anything, that can be race, culture, that can be gender, maybe not sexual orientation that early on, but of course any sort of early, characterological difference or variation can also make you really vulnerable to invalidation in the environment, right? That could be socio-political sort of oppression, which can come through as invalidation, or, more directly with people behind you. And that the argument is that for those sort of populations, it can be in the presence or absence of having emotional sensitivity that you could still end up developing emotion dysregulation, because of course the level of invalidation in the environment is such that it will overwhelm your ability to develop, some of those coping strategies over time. So it's important because, of course, not everyone comes and identifies with this idea of being emotionally sensitive from a young age, and therefore, we know that there's other pathways to those difficulties. This is important because this is our underlying model, so this helps us sort of structure our thinking and the treatment, help you hopefully understand how things have become difficult or how difficulties are developed. And then, of course, we spend a lot of time using those 5, parts of the treatment really to try and help, skill you up to manage difficult emotions and translate that into your world. So that ultimately, the aim of DBT at the crux of it is to help you build a life worth living and help you thrive as a human. And that's really our sort of main aim.